People who were diagnosed with cancer. What symptom made you go to the doctor? I had sporadic stomach pains that felt like gas pain for like 6 months. Even did a video chat with a doctor about it who told me he wasn't concerned because it didn't sound like appendix or gallbladder issue. Some months later pain was terrible one night. Went into the ER and found out I had stage 4 colon cancer. So basically terminal the day I found it at 38 years old. I definitely recommend getting a colonoscopy early or at the very least doing a blood test for C, which is often produced by colon cancer. They found the cancer on my mom's intestine when they did the hysterectomy, which they only did because she was having abdominal pain and kept insisting something was wrong. Finally her OBGYN was like, maybe it's a menopause thing, we can remove the uterus, and then during the surgery they found it. That was a fun post-op visit, and the surgical oncologist on call happened to be an expert in her exact cancer, which is a rare one. So we were very lucky, and she's in remission now. But they would never have found it in time if she hadn't kept insisting that something was still wrong even when they tried to diagnose her with anxiety. This is a lesson I learned a long time ago. I was born with a spinal cord disease, so pretty much the only thing I do is go to doctors. You essentially have to force your doctors to do anything, which is incredibly difficult. I felt a lump in my wife's breast and convinced her to have it examined. Luckily it was relatively early, stage 2, and after surgery and chemo she's fully recovered. The funny thing is, I sometimes think her other breast feels kind of lumpy, but she gets examined multiple times a year now and I'm sure they would catch it, so I figure I didn't really know what I was talking about, and it was only a fluke that I thought it was cancer and made her go see the doctor. Not myself, but my dad. Mostly little minor things that may or may not have been because of cancer, but the big indicator was his rather sudden inability to poop. Within about 2 or 3 months he went from normal to haven't been able to poop in 5 weeks. First doc misdiagnosed him, a month and a half and an ambulance ride later found out he had late stage 3/stage 4 colon cancer. Wasn't a whole lot they could do at that point, but there were things that improved his quality of life for the remainder of his life. They gave him 6 months. He lasted 2 years. The moral of the story is if you can't poop, go see a doc ASAP. Not being able to poop is not normal, and is not okay. Better safe than sorry. Addendum: any change in bowel habit that is not normal for you, go and see a doctor. By the time you get to the not passing anything stage, it's normally because the tumor size is so big it's blocking everything. Glad you got longer with your dad than expected. Had a grapefruit-sized lump forming in my upper thigh hip area. Seeing as I was a naive 11-year-old, I thought it was a hernia or puberty related. Turned out to be primitive small cell sarcoma that spread to my lungs. Been all clear for 13 years now. Just left to deal with the mental aftermath and the potential of aftermath of the high-strength drug treatment I was given at such a young age. Woke up one morning with extreme abdominal pain. Went to the ER and was diagnosed with appendicitis. Had surgery that night to remove appendix and was released from the hospital the next day. A week later my surgeon called me and told me they found a tumor in my abdomen and sent a biopsy to the Mayo Clinic. Was diagnosed with pseudomyxoma peritoni. 2 months later had surgery and chemo to remove the tumor. This was back in 2013. Blood in my poop. Told my doctor. Had a colonoscopy and they found stage IV colon cancer. Been dealing with it for almost 2 years now. I wasn't diagnosed but my mom was. She would get an fever out of nowhere every night but feel otherwise fine and it would be gone by morning. Turned out to be Hodgkin's lymphoma. I've had a fever for almost a week. Please stop. Not me, my dad. He bought one of those stair lifts. Used and after it was installed he fell off it. I'm not sure about exactly what happened, and was injured. He went to get checked for this injury because it kept hurting. They found a tumor in his kidney. Had a colonoscopy pre-op and they found another spot as well. They did surgery for both. Removed the one kidney in full and 2 places on the colon. Neither cancer was related, which is good because that means one had not spread. My dad will be 80 later this month. He is 2 years later and cancer free. He gets regular checkups and includes prior colonoscopies. The only way they might have found this would be a CT scan of the body, which they don't just do. I did recently hear that they don't recommend colonoscopy after a certain age, which I find strange. But maybe it was without family history or something. Think this is assuming you had regular ones before. After 75 or 80 think the thought is as if you made it that far you should be good. They actually brought forward the starting age to 45. I had no symptoms. It was caught on a routine mammogram when it was too small to feel, even by experienced doctors, and it was just below the skin. Get your screenings. They caught my grandmother's tumor when it was the size of a grain of salt. It's amazing what mammograms can do. I had a cough that got progressively worse over a few months to the point I was barely able to talk above a hoarse whisper. X-ray showed a shadow near my lungs. CT showed a softball-sized mass crushing my left lung. Blood work, bone marrow biopsy and PET confirmed non-Hodgkin's lymphoma. Not what I was expecting at 25. But I went through 7 months of treatment and have been in remission for almost 8 years now. I remember singing a song and I couldn't sing loudly. I'm not a great singer, but I remember being in my kitchen and thinking it was strange. It was NHL. I was a month away from my 25th birthday when I was diagnosed. 10 years in remission. I woke up struggling to catch my breath. Went to my physician and was told it's nothing, despite being able to feel a bulge in my abdomen. After another day of wheezing I got a CAT scan and was diagnosed with stage 4 kidney cancer. It had already spread to both lungs and the other kidney, with the original tumor being the size of a grapefruit and had attached to my aorta. Been cancer free for 15 years now. Good for you for going in for the scan, and congrats on doing so well. Around Thanksgiving last year I had a lump on my neck and that was the one that made me go in for cancer specifically. For a whole year I had been scratching myself crazy as if I was allergic to air. Had been going to the doctor every couple months trying to figure out what the heck was wrong with me. Night sweats so bad I'd change my sheets every day for a month. A week of no hunger at all towards about when the lump showed up. Never weighed myself but I dropped down to 120 pounds apparently. Wasn't till that lump showed up that everything clicked. I had Hodgkin's lymphoma, blood cancer, stage 4. Obviously I'm alive but they don't call you cured till you've gone 2 years without a problem. A year and some to go till I'm cured. My mom had back pain. When investigated the pain was referred from her liver which turned out to be a metastasis on the liver from primary lung cancer. Referred pain is a B. My tooth pain is linked back to my heart. It's weird as all heck. Not me, my ex-boyfriend. He had a UTI that wouldn't go away. Scans revealed non-treatable cancer throughout his major organs. Can't remember the name of it but it was very rare. He had surgery, chemo, radio, the works. Died less than a year after being diagnosed. He was 21 and the healthiest person I've ever met. I'm so sorry. Only semi-relevant as it wasn't cancerous, but the symptoms were caused by a primary tumor. It started with I thought were weird migraines. In addition to headaches, I just randomly vomit with only about 2-3 seconds warning and occasionally get really intense deja vu like sensations about memories I knew couldn't possibly real. Later, this progressed to full tonic-clonic seizures. I had knee pains. Started in my right knee, then my left. Had rays done. They found nothing. Then pain started in my hip and to my back. More rays. The doctor noticed a spot. Had a CAT scan or MRI down. Don't remember in that when they noticed the tumor on my spine. Found a lump just above my collarbone. Only found it by chance when I woke up with a bad neck. In hindsight I'd been suffering with crippling fatigue, no energy to get off the couch, sleeping for 9 hours and waking up as if I'd never had a sleep, napping for 2/3 HRS at a time. Turned out to be stage 2 Hodgkin's lymphoma, unfavorable due to the spread in my lymph nodes. I'm halfway through treatment and responding well. If in doubt, always go and get checked out. I got out of the shower and was drying my legs. For a few weeks I felt pressure around my throat but this time it was immense. Looked in the mirror and my face had turned blue. I had an 11 cm tumor putting pressure on my throat and my arteries. I'd had breathing problems and itching and sweats night and daytime for weeks. B-cell stage 4 NHL. 10 years later and I have another child. They said I never would and I'm okay. Can I answer for my brother? He's no longer with us. It was his weight gain. 2 doctors in the state of Oregon said it was a thyroid problem. The third in Maryland, USA, finally did tests and confirmed it was, indeed, Cancer. He was hungry all the time, which wasn't normal. He also began talking about coffins, burial plans, and heaven. Again, not normal. Sadly, they weren't able to do much, but now we can educate others. If you ever feel swollen, sore, or hurt in your lymph nodes, or begin gaining weight randomly, it's better safe than sorry. My left leg just kinda was bugging me a little. Then it kept doing it for a few years off and on and I never thought much of it. Then when I was 19 the same leg was bothering me in the same spot and suddenly that pain went from bad to worse. It was Halloween of 2019 and I was doing rounds at my college. And all I did was step to open a door and a very sudden and sharp pain occurred. It started to get better but the what and why just made absolutely no sense to me. So I went to the doctor to have it scanned. Turns out I had chondrosarcoma, cartilage cancer, in the proximal, outside, portion of my femur. The tumor was roughly the size of a Nerf football. The reason the pain had started to get worse was because the bone had become so porous and gapped due to the cancer destroying it that it was starting to fracture. I ended up having to get a biopsy and not even a month later a hip replacement. I ended up living though so far. Moral of the story: sometimes check into those little annoying pains. I didn't even know there was such a thing as cartilage cancer. December 2015. My dad passed out in the middle of the day. Luckily he was in public and not alone at home, and some people called the ambulance. 2 days at the hospital and it's clear, lung cancer that has already spread into multiple other organs. The 1st of October 2016. Died in the middle of the night. Coughed up a ton of blood. Tried to reach the phone to call help. Fell and cracked his head open. I'm so sorry. Warning: NSW. Blood in my semen. Doctors thought it was a common infection which is known to cause that problem. I did antibiotics 3 times and it didn't work because, well, I didn't have an infection. Eventually it stopped happening, so we figured it must have fixed itself and decided to just be happy with that. Then a few weeks later I felt a mass growing near my groin. My doctors thought it was a cyst and set me up with an appointment for a general surgeon to remove it. They sent samples to the lab and turns out it was cancer and it was causing internal bleeding, hence the blood in the semen. Lesson here is if you have blood in your semen, maybe don't let it slide even if it goes away on its own. Been cancer free for about 4 years now. Not me, but my mum had a sore hip for a couple of months. She tried physio, chiro, acupuncture, etc. Eventually I convinced her to see a doctor and get a scan. By then it was too late. She had stage 4 lung cancer, never smoked in her life, which had metastasized and spread throughout her bones. She got lucky and put onto trial, so we got to keep her for 2 years, otherwise she would have had 2 months. My dad has a little blood in his urine. Then one night he couldn't pee. A visit. Emergency surgery. Stage 4 bladder cancer. I freaking hate cancer. About a decade ago doctors found a spot in my grandpa's lung. At the time, they told him it wasn't anything to worry about. As time went on, his breathing got worse and worse and he got bronchitis all the time. Eventually he went back in and they found that the spot was bigger. It was lung cancer. Last July, I had a lymph node on my neck that swelled up. An ultrasound, CT scan and biopsy were all inconclusive. No one could see anything. Finally got to see an ent and he put a scope down my throat. Within seconds, he told me there was a growth at the base of my tongue and it was probably cancer. That was a tough call to my wife from the parking lot. We thought he was going to tell me everything was clear, although in retrospect I'm not sure why. A biopsy and a PET scan confirmed it. The ent removed the tumor with a surgical robot last September, and I completed radiation therapy a year ago. My 1-year PET scan was clear, which was great news. Now I'm staying vigilant and hoping that everything stays clear for the next 4 years. Not me, but my mom. She was feeling tired all the time and noticed when she ate steak she felt great. Skin started turning a bit yellow. Went in to run tests. She has type 2 diabetes, and her doctor called her and said she had a hospital room waiting. Do not wait, get there immediately. She had AML, acute myeloid leukemia. She passed away 2 years later. Fun fact, they don't tell you that even if you beat AML, which she did, she was in remission. They have only around 5 years to live. AML is a horrible thing to watch someone go through. I miss her every single day. My Sil was 12 weeks pregnant. Became short of breath. Went to hospital where they intubated and put her on ventilator. Diagnosed with AML. She hemorrhaged and died within 36 hours of admission. She was 29 years old. Thanksgiving 2013. I went to the bathroom and was peeing dark red blood. Went to the emergency room and they ran a bunch of tests. Told me I had a bladder infection and stage 4 kidney cancer. It had already spread to my liver and lungs. They told me I have 2 years left to live, removed my kidney and the tumor, and put me in a trial treatment program involving stem cells. Now I have no detectable signs of cancer. That's great news. Not me, but my mom. She was having pretty bad GERD, which ended up being unrelated to her cancer, but they did an MRI to see what was going on and they found a small mass in her lower right lung. She had some symptoms too, a cough and some pain. Turned out to be small cell lung cancer, limited, thank God. She just finished her last round of chemo yesterday. She gets a scan next month to see if the treatment is working, then it's radiation therapy. Not me but my mom. She went to the ER for what she thought were kidney stones. She had had kidney stones before and the pain she was feeling was pretty much the same. What it turned out to be was stage 4 lung cancer. No, she wasn't a smoker and never lived with a smoker. And a tumor had formed around her spine, eating away the vertebra and putting pressure on her spinal column, causing the pain. Other than that, no other symptoms. I went to see a urologist because of recurrent UTIs. He prescribed an ultrasound to check that nothing was causing these UTIs, such as a microfistula, which revealed a lesion the size of an egg on my left kidney. He asked for a CT scan so that he could have more details about this lesion, and it turned out that after the CT scan the radiologist strongly advised me to contact my urologist quickly. I had a carcinoma that was starting to make polyps and the next step for the tumor was to start spreading. I had my kidney and part of my adrenal gland removed and didn't even need to do chemo since everything had been removed. The pathologist confirmed that everything had been removed, but no symptoms, which is why kidney cancers are discovered incidentally and very often at an advanced stage, or they are discovered when they start causing symptoms, which is often too late. Just doing an ultrasound every now and then would help to avoid reaching the stages where nothing more can be done. Not me, my mother. She developed jaundice, was diagnosed with liver cancer 5 days later. Took her life 9 months after the diagnosis. Love you mom. Miss you every day. I'd had what I thought was a persistent stomach bug, but started noticing really dark stools and dark, almost brown, urine. Went to doc and he put me on liquid diet for a few days to clear it up. A couple of hours later I went jaundiced, and went in again the next day, after tests to rule out Hep A. I went in for several imaging studies and ended up being diagnosed with bile duct cancer at stage 3B. It's extremely rare, fewer than 8,000 a year worldwide I think, and aggressive, less than 10% 5-year survival rate, and typically doesn't set in until the 60s, with no apparent cause other than bad luck. I was 37 at diagnosis, but just turned 40. Physical scars notwithstanding from 2 abdominal surgeries within 5 days. One a partial liver resection and some other work under the hood. The other an emergency surgery to clear an abscess and do more work under the hood caused by said abscess. Plus about a dozen other smaller procedures, and you'd never be able to tell what I've been through. Constant squirts, then constipation. Frustrated me enough to offhandedly mention it to my neurologist. Surgery 9 days later to remove a huge tumor. Stage 3 colon cancer. 22 years ago. Back when I was a baby, my dad noticed that in pictures of me there was something off with my eye. Instead of having the red dots over my pupil, it would only appear over one. They took me into a doctor just to see what was up, and immediately after looking into my eye sent me into surgery the next day. It turns out I had retinoblastoma, which already at that point blinded my right eye and was close to blinding my left. They removed my right eye and froze the tumor behind my left eye. Thankfully I only have permanent vision loss in one eye instead of both. I have heard of that diagnosis tool. It's amazing your parents followed up. Glad you're still with us. My brother had a persistent cough and felt tired. We had a family trip to Ireland planned, so my mother insisted he go to a doctor before the trip. Lung cancer. His first chemo round was the week before the trip. He was cancer free for a year after the chemo, but then the cancer came back. He couldn't tolerate more chemo, and he passed away shortly after his 52nd birthday. Smoking kills. My mother had persistent nausea and vomiting that she attributed to a nasal drainage issue that she has had for most of her life. Then she started itching all over and nothing seemed to help. Finally persuaded her to go to a doctor and realized she was jaundiced when I got her out in the sunlight. Pancreatic cancer, with the tumor obstructing her bile duct. Stage IV, with spread to her liver, so no surgery options. We are 6 months into chemo and her tumor numbers are climbing again, so we are just focused on getting through each day. I'm sorry to hear. In addition to having my own issues, I lost both my parents to cancers. My mom's battle was incredibly short, which I sometimes think was a blessing. Hang in there. I got a scan to investigate persistent pain around my coccyx and lower right abdomen. The scan revealed a tumor on my appendix. After 2 surgeries the cancer was gone, but the coccyx pain continued and turns out to be a completely separate condition. If I didn't have that non-cancer condition, it would probably have taken a few more years to discover the tumor and I'd be dead instead of posting on Reddit. This is my father's story. He went to the hospital to get a lymphoma removed from his shoulder, and as the doctor was wrapping up the appointment, ready to send him home, the nurse spotted a concerning mole on his back which the doctor had missed. Turns out that nurse's attentive eyes saved his life, as the mole pathology report revealed it was a malignant melanoma that could have cost his life if found any later. They removed all nearby lymph nodes and luckily the cancer hadn't spread to them yet. Now he has scheduled checkups, though he is declared cancer free. Went to the ER with something different. Randomly had a CT scan, and they came back with, by the way, this thing came back, really small, and might be nothing. Have a doctor check it out the next time you go in. No rush. Stage 1, really small, almost didn't qualify for the biopsy. So far so good. Post-surgery and radiation, just losing some hair. My wonderful 4-year-old daughter was not planned, but thanks to her, I decided to have a vasectomy. I had always had one slightly enlarged testicle due to a mountain biking accident 10 years prior. My urologist had it biopsied because it didn't look right. Turns out I had had testicular cancer for an impossible to determine period of time. 4 rounds of chemo later and I'm perfectly fine. Had I not had my daughter, I would have probably had much worse results years later when it finally made its presence known via pain and had spread into my body. So my daughter technically saved my life, which is knowledge I'm sure she'll use on with great glee during her teenage years when I'm trying to punish her. As a med student, reading all this comments about people experiences with doctors dismissing their concerns repeatedly has been very insightful indeed. I'll definitely remember these comments when I get to my practice and not dismiss any patient's concerns. If I may speak for my father, our country has pretty good population screening for different cancers. My dad received a colon cancer test kit in the mail. He took it, sent it in, received mail back that blood was found in his stool he sent in. Just before Christmas 2019 he saw an oncologist in the hospital. Right in the first heat of COVID he had all his tests done. Turned out it indeed was cancer. Due to COVID his operation to remove part of the colon was diverted and cancelled multiple times. Half a year later he could finally get his surgery, and for the last 1.5 years, he has been clean. Not my experience but my dad's. He had this cold that just wouldn't go away. Stuffy, plugged up nose. He went to his primary care doctor who examined him. Told him he had a deviated septum, which was weird because he has never had that. Sent him to imaging and found a brain tumor. More tests found multiple myeloma. He passed 5 years after diagnosis. He was 55 when diagnosed. Stage 3 rectal cancer. My first symptom I can recall was having diarrhea every morning, usually just once after I woke up. Eventually it became an all-day thing and I started having pain in my butt muscles after sitting any length of time. I thought I might have IBD. Cancer never crossed my mind. Woke up from my colonoscopy and the doctor said I had a huge tumor and would need chemo and surgery. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.